Good morning, everyone. It's February 10th, Wednesday morning, 9:30. Thank you all for joining me today with the update from the city manager here, Mornings with the Manager. I want to talk about 5 topics today, or inform you about 5 topics. Topic number 1 will be uh, about COVID-19. Topic number 2, I want to provide you with some information where we are with respect to the commercial cannabis project we are working on. I cannot spare you then to talk briefly about the budget, and I will talk about the rental assistance program briefly, and I will also talk about some of the opening strategies that we are pursuing for the library, sports center, and the recreation centers and recreation programming. So I hope that I will cover a lot of topics in the next 30 minutes or so. COVID-19, as you can see from the data that is being published by the County of Monterey, the numbers generally are trending downwards. That certainly has something to do with the catching up with the events that caused the spikes. The infection rates are going down. Also, the hospitalization rates are going down just because the holidays are way back now in the rear view mirror. Yesterday, I heard somebody talking about, not here in the county, but on a national level, that there might be the chance for another spike in April or May. So we have to remain vigilant, and we have to continue being very, very conscientious on what we are doing, who we are meeting with, etc., etc. So the numbers are trending downwards. That is pretty good. Vaccination is on everybody's mind, and every single day our local news stations are talking also about vaccinations and clinics here and there and popping up. Um, Here's what I can share with you. The vaccination clinics are increasing, so there's definitely a positive trend. You see that Montage Health is holding vaccination events out at Chomp as well as in Marina. You see that doctors on duty have vaccination for folks. You see that there are different other entities that have vaccinations and providing them. So there's definitely, you can see that there is very, very marginal, but there is progress made in the right direction. What we learn from the county, though, is that the county of Monterey does not have MCEs in the county. And I like you to again, remember what MCEs are. MCEs are multi-county entities, MCEs. And the MCEs are receiving vaccinations from directly from the state. They don't have to go through the county, and MCEs are large healthcare provider that span multi-counties, i.e. Sutter Health, Kaiser Permanente, etc. And since the county does not have MCEs, you have a lot of request from the county to increase the allocation, but the MCEs are the ones also that receive more vaccinations, and that's why you see that some people drive over to Santa Cruz County and get their vaccinations there. There's a good question. What is the plan to get Monterey City residents over 65 vaccinated? And Monterey Zip Codes were excluded, and where the vaccination station on the peninsula. And that's a topic that I wanted to address as well, and thank you for the question. So there are a multitude of vaccination places right now across the Monterey Peninsula or Monterey County. The challenge is that they are popping up, and that you have access to those different spaces through the Monterey County Health Department's website, who is posting where those areas are. And sometimes you have to sign up through the website of the healthcare providers. Montage Health has their own sign up, and that is still a process that I feel is confusing and needs to be further fine tuned by the county. Why are zip codes in Monterey excluded? Simply because there is a preference given to those hardest hit areas with respect to infection rates. And if you think about the infection rates that we had, and if you think about the purple tiers we have been in now for a long time, the state mandated something that is called equity metrics, and they want to ensure that certain areas that are the hardest hit are being preferenced with respect to vaccination distribution. And I don't know exactly the details right now that the county has published yesterday. I understand that Dr. Moreno went just yesterday in front of the Board of Supervisors and spoke about opening it up for certain age groups 65 and older. But I think he also mentioned a few other uh, areas where the vaccination would be started more preferential. Again, this goes back to the mandate by the state that the county has to abide by, which preferences certain zip codes that have higher fatality rates and higher infection rates. And more details I have to learn from what yesterday came out of the Board of Supervisors meeting. And again, the county is looking first and foremost also to ensure that the essential farm workers who have the highest infection rates also receive vaccinations as well. We, as the city, have contacted the county on various channels, not just the city of Monterey, also the other Monterey Peninsula mayors, and we are working collaboratively with them, and we want to ensure that our voices are heard as well. Um, Lastly, please, right now, this is a county-driven process. County public health department is responsible to comply with the state mandates and the state guidelines. And the state has made it also very clear if they feel that counties are not paying close attention to what the state wants to do, that they will restrict the rollout of vaccines until they know that their guidelines are followed closely. This is all developing as I speak, and things keep on changing there. Every briefing that the governor holds appears to me that also he changes directions here and there. So we are working again, like I said, as cities collaboratively with the county to figure out how we are getting more vaccines into the arms here on the peninsula. The other challenge that you have, or that we have sometimes, is that the data that the county or the state is tracking is not real time. You can really see, if you know the real numbers, you know that a certain entity has distributed all the shots, and the numbers on the respective website from the state and the county doesn't get updated for 7, 8, 9 days, leaving you with the impression that there are shots somewhere in refrigeration units. There are shots in refrigeration units, but there is a real data lag in getting those numbers out. And again, the state and the governor's office is very much aware of that, and they are working hard to provide us with better real time data. If you go on to the CDC website, you see actually that the state of California's numbers have improved significantly, and shots in the arms. We are probably now at 12,800 shots into the arms per 100,000 residents in the state of California. So you see a positive trend. I also learned yesterday that the federal government is sending out more vaccines. That translates to about 28% more vaccines per week sent out to the different states. So we are progressing into the right direction. I need to be frank with you. I feel everybody's pain with respect to the sign up procedures. There is too many multitudes of different elements of signing up, and unfortunately, right now the challenge remains to be adverse and find out where can we sign up what. You heard about the veterans office. The Veterans Clinic here in Marina will receive 600 doses of vaccines for veterans, so they don't have to drive up to Palo Alto. They will get it here in Marina. Details of that have been shared yesterday and are probably also available on the relevant website. So that's another 600 folks that will get the shots in the arm, and every single shot helps. Um, I wanted to talk briefly about one other topic that we all need to be aware of. The county of Monterey has, starting in March, always an inflow of seasonal workers. And these are farm workers that come to Salinas Valley and help the ag industry with the agricultural work in the valley, including laying out the fields and harvest. Uh, the county speaks about 35,000 people are coming into the county. And the county also has made it very clear to the state that the allocation that the county is expecting does not include the 35,000 additional migrant workers, farm workers coming into the county, because the state is looking mainly at census based data. And those folks are not being counted because, frankly, they are seasonal. And so the county supervisors are pushing hard to get the state to look into the allocations and also look at increasing those numbers. This has not been solved. Another issue that has not been solved either is that there are farm workers coming out of areas that have been identified as hotspots for COVID-19. And again, the county health has to figure out a way to ensure that those farm workers also are being educated and helped with respect to all the relevant procedures. The ag industry is very supportive of that, and I would just say stay tuned, follow that topic, because, like I indicated earlier, certain zip codes have higher infection rates, and you can see those numbers when you go on the county website. They are published every single day, and you see that there is a need to do more for those farm workers coming and helping to ensure that our infection rates stay low. Last but not least, whatever happens in the valley has an impact on our economy here in on the Monterey Peninsula, because we are one county, and their numbers are our numbers, and that's something that we follow very closely, and we want to make sure that our voices are heard as well, because unemployment and struggling businesses are especially hard hit here on the peninsula. Last topic for COVID-19, 3-day weekend is coming, which is the President's Weekend, 3-day weekend, President's Day weekend. Our preparations are the same preparations we had on previous weekends, 3-day weekends. Now the weather looks like will be helping us a little bit, because there is some rain possibly in the forecast, and people might not really come to the coastline. But we are preparing the city for the 3-day weekend as best as we can, as we have done many times before during similar banner weekends that we expected due to the weather, or 3-day weekends. I want to say it plainly to you: we cannot fix stupid. We cannot fix stupid. So if you have people coming and they are not wearing a mask, we will try to do the best to be out there. We will have community services officers from the police working the whole 3-day weekend through. But as I said it before, we cannot be everywhere at any time. And it's still mind boggling for me that people are not adhering to the mask mandates that has been promoted now from the federal administration down to the cities. So unfortunately, I haven't found out the solution yet how to fix those people that think it's good not to have a mask. And of course, there are our efforts to really be out there and educate. We also reached out to the WAF Association to work with them again, because we expect again that there will be a larger crowds on the wharf. As well as, in addition to that, we will have increased litter pickup and litter control over that weekend, and signage gets again updated, replaced wherever we had missing signage, and so on. So this will be the first weekend really where we have to look again at the crowds. I really hope we are prepared enough, but I just want to let you know, it, we cannot be everywhere everywhere at any time. And again, I haven't figured out yet how to penetrate the brains of some people who still think not wearing a mask is good for all of us. With that, I want to jump into the cannabis topic, and I want to talk about the outreach that we have done so far. Um, I wouldn't say we have completed the outreach, but I think we hit all the stakeholders. We hit all the folks that wanted to say something. Sometimes we met them multiple times during virtual meetings. We have received yesterday the surveys back from the post office. And just to tell you a little bit about our day-to-day work here, the person in the post office was supposed to ensure that we get those surveys sent to us as soon as they are being received. That person was out, I believe, for one reason or another, whether it was vacation or sick. But so yesterday we received around 700 surveys. That's our initial estimate as how many we received back yesterday. And so, of course, today we are trying to process those surveys and get the data into some sort of a spreadsheet to understand what our residents want. But the response to the um, uh, survey sent out is very, very helpful, and we are really looking forward for that. The results of the survey, as well as the data that our sales tax team has analyzed of potential new revenues, will be shared with the public on February 24th. And you can all tune into that public council meeting. And at that time, we hope that we can give the council also a general feedback about what the pleasure of the public is. The public outreach meetings were almost all 100%, 99%, 90% positive. I think we will have some other responses in the written survey, and we'll try to come up with a recommendation to the council and how to proceed with respect to cannabis. So again, 24th of February, please take a look at that. It will be very interesting. Budget. Um, Last night, KSBW showed a report from the city of Santa Cruz that is facing a $3.7 million deficit. And when I saw that, I was thinking how lucky they are. $3.7 million. That's a deficit, but that's not the category. That's not the dimensions that we have to deal with here in the city of Monterey. Last year, for this fiscal year, we reduced our budget by around $18 million because we anticipated an $80 million deficit. I can tell you that came true, and with the additional stay-at-home order and our projections, I think we are an additional $3 million in the hole for the current fiscal year. So we already reduced by 18 million. We have another challenge of another 3 million or so. So our budget here in the region has been hit the hardest from all the surrounding communities. So we will bring that forward also in the first March meeting to the city council. We will give them again and you all the detailed numbers, and we also provide the council with the suggested courses of action. We have parachutes that we need to pull in order to save our budget, and that will be a process that we will outline to a degree in March. Uh, Parallel, we started last week also our internal budget review process where we basically first count our money. We sit down and say, okay, how much revenue can we expect? And then, of course, we have to align our expenses with the revenues coming in. And that process in the city of Monterey has started last week with an internal budget kickoff meeting. And there will be checkpoints where we will check in with the public and the council about our proposed path forward for the next 2 fiscal years. I wanted to talk briefly about the rental assistance uh, program. We ran out of money with that. So over the past 2-3 weeks, we had a real increase in checks that have been issued. And as of today, I think we are allocating over $950,000 to the rental assistance program. That's about $100,000 more or less. That it's actually $100,000 more than we had originally planned. I think the number is actually a little higher than that. And we can afford it right now because we have additional housing program income fund. But what I plan on doing is twofold. Number one, the county of Monterey has received federal stimulus money. In the last stimulus package, there are funds for rental assistance, and the county of Monterey has received $26.7 million in funding for rental assistance. And we have asked the county, I think 2 weeks ago, to ensure that we get a share of that funding. The county is receptive to that. Is working through United Way to allocate that funding. And last week we attended a meeting with United Way where the different entities were informed on how we could access that money through a competitive bidding process. And so we are working through that process, but we also are working another line of asking the county for immediate support for that. So we really hope that we have a fast allocation from the county. As of now, we have stopped the rental assistance program because we have no more money in the pipeline. And we are informing the applicants right now that we really hope we can reinvigorate the program sooner than later. As you know, we started that in August, and we have made payments over $900,000 so far. And the money just simply right now is not there, and we have to figure out a way how we can continue that. Our housing program funds many times get spent for many causes. One of them, this in the past year, was really rental assistance. That was a priority for the council. We have to see where we are going in the next years or so. It will be the council decision. There are other interesting projects that the council likes to support with the same funds, like homelessness. Noche Buena is a new shelter in Seaside, which really depends on multi-agency financial support. The strongest one will be the city of Monterey. We also work through community human services. We fund Salvation Army to a degree. We fund Interim, which is also a very noteworthy organization. So the funds that the city has are finite. the funds that the county has are also finite, but the difference is they got $26.7 million for the whole county, and we have a successful program, and we hope we can work this all out. There are strings attached to the $26.7 million. I understand right now there are two different larger pots of money. One comes with one set of conditions of approval, and the other comes with another set of approval. So it will take a little bit of time to figure all that out, but our team is on it, and I really hope that together with United Way and the staff of the Monterey County, we can figure this out. Um, Esther asked a question about Caltrans and trash and encampments. No, not they yet. There is no additional news right now. We will be meeting with the Caltrans director. I believe actually it's today and or maybe tomorrow or so. We have a meeting set up with the Caltrans director to talk about the litter and the encampments. Uh, I can share with you the topic is not something that I think Caltrans will feel obliged to solve or to address. The state has made the determination to keep homeless encampments where they are, as they are promoting the idea of shelter in place, and with that, the homeless folks can also and have the right to shelter in place. And so far as we have not received a great deal of support from the state elected office holders as well as from the state itself. So we are trying to come up with a workable solution. We will, of course, share that with the council what the outcome of that meeting is. The trash pickup, yes, Esther, we have additional resources allocated to trash pickup. We are cleaning up encampments because the homeless encampments are not cleaning up after themselves. We started that in August, September. Some areas are just areas we are not allowed to clean up. And these are the Caltrans areas, and we really hope that they will work with us on the cleanup. However, I can share with you also that I feel Caltrans there is a little less flexible as the city is because we added additional contract labor for trash pickup in certain areas. Uh, with that, I want to talk about the last item on my list here, that is reopening strategies. We're talking internally with our department heads, the Parks and Recreation Director, Karen Larson, the Library Director, Inga Wade, and we try to figure out how are we opening our rec centers, how are we opening the sports center, and how are we opening um, the library more. And everything is, of course, driven by public safety, public health concerns, but also it will be driven by fiscal considerations. I do not foresee us to reopen all of our rec centers on the same day with the same type of programming that we had when we closed them down. We are considering to combine certain programs and certain facilities. We need to see also how much the public wants to utilize those programs and how much the public is really returning to the sports center or to the library. There are also fair questions being asked. Should we require everyone who wants to visit the sports center, for instance, should we require everyone to show us that they have been vaccinated? And I frankly tell you right now that we don't know the answer to that, but I think it's a very fair question that if you go into a facility one day where everybody sweats and everybody does shares their droplets, that maybe it might be a requirement to ensure that people are all vaccinated if they go into that center, because we want to feel our people. We want to make sure that everyone feels safe in that. Um, the um, the efforts are underway to come up with a strategy, come up with funding for that as well. And last but not least, we are preparing also for camps again. We're taking a bit of a gamble here, But Camp Kinsabe is really an institution in the city of Monterey, has been for decades the premier summer camp for our children here. And so we are taking a bit of a gamble here, but we are preparing Camp Kinsabe, and we are also preparing Whispering Pine Day Camp. And we really hope that this will be successful, and that we really also with that show some confidence that times will become better. Um, Library is also looking at what do they need as staff when they reopen, and again, we need to plan for a library that is uh, probably smaller than it was when we closed it down. We'll have not 7-day service, Monday through Sunday, but maybe have just 5 days of service. But we want to be sure that we are prepared in the right way also, and provide programming and provide also the library again as a place where people can sit, study, relax, and enjoy getting informed about a multitude of topics. Um, with that, I thank you all for being so engaged and sharing your thoughts with me. I hope that I tackled most of your questions, and wish you all well. Please participate on all the different platforms we have, and I really stay committed to let you know what we know, so that we all understand what direction we march, and then also that we all understand what we want from each other. Because again, this is a community effort, and we all need to know what our priorities are. With that, stay healthy, stay safe, and hope to see you again sooner than later. Bye bye.